Good morning, everybody. Welcome. I'm Sue Urban. I'm a nurse, but I'm somebody with chronic health conditions. And Martha's a friend of mine. I'll let her introduce herself in a second. But we thought because of the theme of the conference, we'd like to present a presentation that was done through a study through the University of Washington. You guys all have a packet with handouts, which you don't need to refer to them during the presentation. It's just something you can take away for your toolkit. And it follows the keys to healthy aging. That's what it's about today. We're going to do an activity at the end, so pay attention to some ideas. And hopefully what you're going to get from this session is ideas and tips that you yourself can use or that you can provide other people to try to get through different stages of aging with a disability, some things you might rub up against, which everybody does as we age. But I think with disabilities, it's a little trickier. So hopefully we'll be able to navigate that. And I'll let Martha introduce herself.
And I'm Martha Chambers. I am a person with a disability. I was injured in a horseback riding accident almost 23 years ago. So I'm paralyzed from my neck down, unable to use my arms or legs, and I also suffer from nerve pain. So I have a pain from my neck down as well. It's kind of like when your arm falls asleep and it prickles and tingles, and my body is like that all the time, as well as arthritis. So those are some of my issues physically, and then I'm an advocate. Presently I'm unemployed, unfortunately, but I'm always busy doing things in the community.
Yep. And Martha and I have been friends about 7 years. Yes. We're both in our 50s. We both talk about these issues all the time. So we've been spending a lot of time. I've been at her house talking about this and going through the presentation, so we hope you enjoy it. These are the areas or the keys that were identified through the study as being the most important and things we need to be, and one of the subjects is mindfulness, to be mindful of. So we're going to talk about, and you've heard a lot about decreasing stress, of course. We're going to talk about that. And I know there's been sessions on mindfulness here as well. We're going to talk more about that. Staying active, sleep, which is probably, these aren't in order of importance, but that's probably one of the most important. It probably should have been number one when we talk about this. Improving memory, employment and volunteering, which Martha alluded to a little bit, so we'll talk more about that. And then getting the most out of healthcare visits, which we can all use. There's, it's called PACT, and you have a handout on it, but we're going to go through using that method to make sure we don't miss anything when we go to an appointment. And then fall prevention, and then energy zaps, so how to conserve energy or get the most out of the energy you have. So those are the 8 keys to healthy aging we're going to discuss. Do you have anything to add to that?
No.
Okay. So, decreasing stress through mindfulness. I almost said mindlessness. Which wouldn't, it's kind of good, right? Because then there's nothing in your mind. So mindful or mindful. Mindful is when your brain's just spinning and there's too much there, right? And mindful, which we're going to talk about, is staying in the moment. So being mindful is being tuned into what's happening right now. Present, what you smell, see, feel, and any physical sensations that you have. So you're just aware of everything that's happening right now. And focus, paying attention to what's going on in the present moment, not thinking about the past or worrying about the future, just right now. And then accepting whatever you're feeling without judging it or trying to change it. So trying to control that emotion, you're just accepting it, because you can work through it better if you just accept what you're feeling. And then observing, recognizing what's going on, even when feelings are fleeting or temporary, and then being objective. And I know you have things to add to this, don't you?
Yes, I was going to mention one of my ideas or things that I always think about is there's always things in the past that could be good or bad that you either want to think about all the time and either reminisce, and they're in the past. What can you do about that? And then in the future, things you've planned, things that you're looking forward to or you're nervous about. While you're doing both of those things, whatever is happening right now, you're missing out on. So for me, it's always good to make sure I am present, paying attention to a conversation I may be having, a feeling that's going on, whether it's watching outside as I'm going down the street, whatever might be going on. I want to stay present, and that way I can enjoy that moment. I do have a little saying that I heard many years ago that I really appreciate, and I wanted to share it with you. And it is this: yesterday is history, tomorrow is a mystery, today is a gift, and that is why it is called a present. So if you think, isn't that cool?
So be present, right?
So be present.
Yeah. So that's really good. Thank you. So that's something to think about. And then how do we do that? Because sometimes it's hard. Some people have anxiety, or they worry, they fret. And we all have times when that happens, or too much is going on. So these are some of the things you can do, because you have to practice mindfulness if you don't know how to do it. It doesn't come naturally to everybody. So these are ways you can practice being present and what we call mindful. One is just concentrate on your breathing. And there are actually apps. One's called the app, or there's podcasts you can download, or you can do like iTunes Music or Google Music, whatever you do, and get talking through like meditation that will talk you through breathing exercises if you're not able to do it yourself. Sometimes that helps, and it'll tell you take a breath in, take a breath out. And that's a good thing to do, mindful breathing. That's something I encourage people to practice. And then the other thing, does anybody know what a body scan is? It's not a CAT scan or anything like that. Cindy, you want to share what a body scan is?
Where you just kind of get in touch with each part of your body, where you might be holding stress in your body.
Mm-hmm. Yeah, and release it. And that's what, at night, if I can't fall asleep, and when you think of a scan, when you go in the hospital and they scan your body, zzz, they go over it. It's kind of the same thing. You're just laying there, and you can either start at your head or your toes, and then go over each area of your body and try to relax it. And supposedly by the time you get to your head, right, you've released that tension. And that's a hard one for me to do, the scan. I have better luck with the breathing because I have to focus on that. The scan, I'll start going, ooh, that doesn't feel right in my leg. So that doesn't always work for me, but it does for some people. It's called progressive relaxation is another term for it. Another thing is mindful eating. And that's something that helps you be present in the moment so you don't eat too fast, because that's sometimes a problem with people. So you're present in that activity and taking it slower, being more appreciative of it. And then there's something called loving kindness meditation. It's like positive affirmations. So when you're concentrating, you're putting that out. You're putting that energy out. And what do you think happens if you're thinking about love and kindness all the time? Pardon? Yeah, you get it back. It's just that positive energy out, positive energy in, right? So that's a good way to be mindful. And then just having that mindful moment, taking that moment and taking that time. So these are all good ways you can practice mindfulness. And then the benefits. It improves your mood. It decreases stress, which is the goal, and the consequences of stress. And then improves coping with pain. And to me, that would be first on the list. For people who suffer with chronic pain, that's a really hard thing. You can't just medicate it away. So it's a way that is taught you can relax and get through it a lot better. It improves your brain function because you're concentrating and you're thinking on something. So it helps with that. And it also helps with weight management, especially the mindful eating. So those are just, and I like that little cartoon. keep calm and carry on. But those are just things that you can think about and try to be more mindful. It's a challenge everybody can have for November, mindfulness. The next section is being active. And as whatever age you're at, regular exercise is really important. And it's a part of maintaining a healthy lifestyle, and it is recommended for everybody, including those with disabilities. Sometimes I'll hear the opposite of people. They'll say, I can't do that, or I shouldn't do that. I have problems with weight management, but I walk every day. I have to walk every day, or my joints lock. So it's really important for me to walk. But I've heard people say, I can't do that. I'll be worse. I'll be stiffer. And that's not always true, maybe initially. But that's something you can talk to your doctor about. But you can also do like chair exercises or other kind of movement. And do you have anything you want to add here?
I do. For me, I have come up with some exercises that I do in the evening, even though as a person that has some major compromises. In the evening, what I do when I'm lying in bed is I do sit-ups that I actually concentrate in my bed, and I lean forward and I do as many sit-ups as I can, and then I do these jogging exercises because I can feel the muscles in my body activate. So I'm actually jogging as I'm lying in bed to be as active as possible for myself, and I do that for at least a half hour. And then in addition to that, I do range of motion with the caregivers that work with me, and I do that in the morning and once during the afternoon and then in the evenings. And those are the things that help me to stay active. And as I do those things, it helps my self-esteem. I feel better. I have more energy each day, and it's a wonderful thing that I'm able to do those.
That's great. Thank you for sharing that. Does anybody else here have something they do every day? What do you do every day?
I love to walk.
You walk?
Mm-hmm.
Do you walk outside?
Sometimes outside, sometimes inside.
Uh-huh.
I'm with a walking group at this place that I go to during the day, and we just walk around the building,
Mm-hmm.
talk with the children, and play around with them,
Mm-hmm.
and just have a good time.
Good.
I don't do it for exercise. I'm doing it for the fun.
Yeah. But you get an added benefit, right, being active.
Uh-huh.
Good. So I would say that it's mentally good and physically good, right? And it lifts your mood.
Well, if it's not mentally good, the physical good don't mean anything.
That's good. That's true. That's true. Thank you for sharing that.
I try and walk every day, do some kind of walking.
Uh-huh.
Try and do stairs some because I feel like that helps with my endurance.
Sure. And that is true. That's a hard thing to do a lot of, so that's good.
Like here, I did the stairs most of the time, except for when I had my bags.
Yeah.
Checking in and checking out.
Yeah, that's really good cardio exercise. Anybody else want to share? Yeah, Jan. Uh-huh. That's good. Yeah, yeah. Yeah. Good. And I just read a big article on that. I read Rob Reiner, Carl Reiner. Rob Reiner's dad is in his 90s. Every day before he gets out of bed, he does that. And I just read an article that, and I do have to do some of that or I can't get out of bed, and then I do the walking. But it does help, especially if you have arthritis or your muscles tighten up or if you have spasms. But I read people even who don't have that, it can keep you active longer because you stiffen up at night. Yeah. Anybody else? Water aerobics are great. Fantastic. And how do you feel if you miss it? Isn't you feel bad, don't you? Yeah.
It's the best feeling, especially,
Yeah, because you can move.
float around in the water and just take all the weight off.
Yeah.
It's so
Yeah, I think that if people have access to that, that's really good on the joints. Yeah. Yeah. Good. Thanks for sharing that. Anybody else? Go ahead. Silver sneakers. Yeah. You do everything in your chair. So you do like adaptive type. So do you do like different stretches or yoga or tai chi? Oh, the bands?
Oh, that reminds me.
When they walk, I walk in my
Sure.
chair with my legs up. I try to keep in time with them for the length of time that they're doing it.
So do you hear that? She tries to keep in time with what everybody else is doing. So that's great. So, you're in a chair, Martha's in a chair, and you both say, hey, we exercise. So there aren't any excuses. Anybody else?
I have one more thing when you're done.
Oh.
When you're done.
Okay, go ahead.
I was just going to say, my 92-year-old grandmother does exercises before she gets out of bed because it helps with her stability.
Yes. It decreases fall risk and
And
balance.
every time she stands up, she does this because it helps with her, otherwise her balance.
Yeah. So she does like a,
It just gets
yeah.
blood flowing.
Yeah. And that's, my aunt is 85, and she canoes and bikes. She's part of a healthy aging study. She doesn't have really any type of condition, chronic condition, so she's fortunate because usually by the time people get to 85, you have one or two chronic conditions. So that's unusual. But I'd like to think it's because she always did those type of things to the ability she could. But she does Tai Chi every day, and it helps with her balance tremendously. And she's probably the only 85-year-old I know who's never fallen. So not that she's admitted, but it does help that balance. You kind of lose that. So that's
My grandmother was golfing until she was 85. And
great.
Had a fall.
Yeah, and then it.
Somebody decided to do double knee replacements at 85.
Ooh.
She was doing physical therapy and literally like this.
Oh, that's too bad.
For her.
But
She hates it because she's like one of those people who's active.
right.
And so to be dependent on the walker now, we've tried to get her not dependent.
Yeah, and that's hard because that's a fear of everybody's, right? If you fall or something happens, that can change everything for you. So that's hard.
I was just going to mention that I have a father that started jogging when he was 60. So it's never too late. Never too late to start doing something, whatever age you are, to think, again, I can't do that. I'm, quote, too old, or something's going on. I'm too busy, whatever the, quote, excuse you might come up with. He was 60 when he started jogging, and my mom was doing the exercises in a chair in front of the TV. There was a TV show that she would watch and do the stretching exercises. And she was 80 years old as well.
There you go.
So pretty cool that it's never too late to start exercising or to continue exercising.
I like that story. Your dad started jogging at 60 because that is different, to start that at that age. So what prompted him? Was it a diagnosis or something?
My sister encouraged him.
Just
she was
go
in
run,
her
Dad.
20s. Well, and he felt he needed to start doing something different. So
Okay.
Yeah.
Great. So the benefits of being active, the strength and mobility, we talked about that, and that's even more important if you have a disability, especially if you have arthritis or muscle spasms, chronic pain, anything like that. It's really important you at least maintain to the ability you can. And then improve balance. We talked about falls. We're going to talk a little more about that. Increase independence. Decrease your fatigue. Because the energy, you get endorphins when you exercise, and that can keep your energy up. As long as you're not overdoing it, because then you have the opposite effect. Improves your mood. We talked about that, right? Because why do it if it's not going to... Do you want to add something?
One thing I like doing is I love to dance.
You like to dance?
So I love to dance.
You love to dance.
Because that is also a real pick-me-up for not just physical, but also for the mind.
Yeah. Do you get to go very often?
As often as I can.
All right.
My lady friend in Milwaukee is in a wheelchair.
Uh-huh.
And one time, just for the hell of it, I just picked her up out of her wheelchair and started dancing with her.
Did ya?
Pick me up for the both of us.
Yeah. Well, that's a good exercise, for sure, dancing. And then it improves your mood, so you're going to have less anxiety. And this is, and I don't want people on antidepressants to go off of them when I say this, but they've done studies that show that doing exercise is as effective as taking antidepressants. It takes 2 to 4 weeks for antidepressants to work, and same with exercise. But the studies, long-term studies, have showed it's as effective. Now, some people have chemical or issues where they have problems with serotonin. That's different, but it's one drug that's overprescribed in society. And doctors and patients are used to more quick fixes. And if a doctor said, here, go exercise, how many people would do it? So they write a script. But it's just something to think about. It can help improve moods to the point where people might not have to go on them initially. It improves cardiovascular function, which lowers your blood pressure, and then improves social interaction. We talked about that, and your self-esteem. You feel better about yourself. It improves your bowel and your bladder functioning. So if you have poor motility, maybe you have cerebral palsy or a muscular condition or chronic pain and you're on pain medications, walking helps get those systems moving, or other exercise. And then clarity of thinking. You can think clearer. Clears your head. It also improves your sleep, which I said before is a really important point of healthy aging, and prevents weight gain. So those are all benefits of being active. So as Martha said, it's never too late. Her 60-year-old dad, that's a great example, or her mom at 80 doing the exercises in the chair. And it's a great way, as we talked about, to improve well-being for older adults with a disability. Well, for all of us. And then it can be done safely, but again, you should check with your doctor because you don't want to start a program unless you consult with your physician. There's people who have certain things where maybe doctor doesn't want you to do cardio or wants you to do slow, kind of maybe balance type. Also, maybe you can start out with working with a physical therapist to develop a plan. So consult with your provider and then set realistic goals. It's another thing that people will sometimes go all in and then quit because they're not, it's just like, and I did this myself, Cindy probably remembers. Our health plan offered this 3-month Get Well program, and I signed up for it. And I lost 30 pounds in 3 months. But I had to work out an hour a day, intensive boot camp, pushing tractor tires, running through sand. You know, so I went from A to Z, and I about killed myself. I hurt my shoulder, which now I had shoulder surgery because of it. I blew a knee. And my doctor at the group health plan goes, why did you do this? I said, well, your health care company said this is great. He goes, no, you need to go much slower. So now I'm back to walking and stretch bands, but it wasn't for me. I don't think, you know, unless maybe there were some 20-year-olds in that class, but, you know, being in my 50s and doing that rigorous, it was not good. So that wasn't a realistic goal. I did it, though. I did it, but it about killed me. It really did. So that was not realistic. Exactly. They should have just said, let's start you out with this. But they made it, when you said stairs, I laughed because they made us go up this huge flight of steps. Do it 10 times. You know, it's like, really? And they'd be yelling at you. And I'd be, oh, God. The tractor tires, that was about it. So anyway, set realistic goals. Don't be flipping any tractor tires. Which they're hard to do. They're hard to do. Huh? Yes. I did.
Oh,
you name it.
no.
I could do the obstacle courses, basketball. You name it, I did it. Every night. Oh, my God. It was rough. I did it, though. I did it. Okay. And this is, let's get into sleep.
No
Let's
sleeping
not
now.
go to sleep, but let's talk about sleep. So, almost half of individuals with disabilities have problems with sleep. So they're 3 times more likely or common in people with chronic conditions. That's probably no surprise, right? If you're talking about muscle spasms or pain, right? So it's not going to be uncommon. But it does affect us. So there's different kinds of disorders of sleep. So insomnia is when you can't get to sleep or stay asleep. And those who have it know it very well. Or another sleep disorder is when you're tired all day because you're not well rested. Part of a sleep disorder. Anybody heard of narcolepsy? Okay. That's when you just fall asleep. You can't control it. And then restless leg syndrome. Have you guys heard about that? Okay. A lot of people have that. And that keeps you from falling asleep and resting. And then bruxism is grinding or clenching your teeth. Yeah, I have to wear white plate. Because then that causes, go ahead.
I was just going to say, I have that issue.
Uh-huh.
And if you are able and know of a massage therapist or a chiropractor, there is actually where they can get in your mouth and release those muscles, and it has helped me so much.
Good.
My dentist was like,
Really?
yeah, and it took a couple of times going, but it is amazing, and it's a lot less expensive than an appliance.
I know. I just spent $490 on a new bite guard. Yeah.
No.
Very expensive. That's a good point, because sometimes they can work on that. Go ahead. You can. But here's the thing. If you really have a medical problem, you need to talk to your doctor about it, because I can't use those soft ones you get at the store or the soft ones the dentist sells. I have to buy the hard ones because of the type of grinding I do. And like you indicated for TMJ, there is manipulation you can do. So first you got to find out why and how you grind, because it can be different reasons, and there's times health plans will pay for it, especially if it contributes to neck pain or migraine. So you should find out the type, because otherwise you're throwing your money away on a guard that may not work. Because those soft guards, I'd grind through in a night. So, yeah. Or I'd end up swallowing it, chewing it and swallowing it.
My mom would spit it out at the end of the day.
Yeah, mine lock on my teeth. It's terrible to have to wear one, but I grind my teeth terrible. Ugh. And then sleep apnea. There's a lot of, yay, woo! That's pretty common. And it's, I think it's just one of those things, again, when undiagnosed. But for people who suffer sleep apnea, if you don't treat it, it leads to heart disease, stroke, dementia. So it's really important, as much as people hate to wear CPAPs, BiPAPs, or VPAPs, that you wear one if you need one. Oxygen too. Yes. Okay. Right. And it would have been dangerous not to have that for you. And did everybody hear that? There's some people who have CPAP machines or BiPAPs or VPAPs that have oxygen plugged into it. Because while they sleep, their oxygen goes so low, they're not getting oxygen to their brain. So they have to have that. So it's essential, in your case, you wear it. But even if you have a... Oh, but then, yeah. Yeah, yeah.
So then yesterday I did too much, and last night I was so tired. I went back and put it on, and
Yeah. Well, and that's sometimes a sign for people. They're so tired in the day, and it's because they're not getting oxygen at night. They're not getting air. And sometimes just that forced air, what happens is your airway, there's different types of apnea. somewhere your airway's obstructed. And the kind you have is called central because it has actually in your brain. And you can't change that with the pressure, so you have to add the oxygen. But that's important. Yeah. 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 So that's important for people who have it. Oh, yes, go ahead.
I was going to say that one thing I love about my BiPAP machine is I get the relaxation from the air pressure going in, and the noise of it puts me away. I'm gone. I'm done for the day.
That's good to know. And that's true. My husband says the same thing. It's like white noise. It's like a noise machine. That noise in the background kind of, you get used to it.
I can't stand quiet.
There you
I have to
go.
have darkness and noise when I'm sleeping.
Yeah.
Otherwise, forget it. I'm not going to get
Yeah.
a good night's sleep.
So it's 2 in 1. Yeah. Good for you. That's good. And then sleepwalking. Anybody have a sleepwalker in the house? That's scary. My son used to do it when he was little, and I'd wake up and he'd be right there, and he'd be asleep, and he'd have these little dark eyes looking at me. It's scary. And your kids sleepwalk, Mary? It's so frightening. It really is. Because they do. You wake up and they're like right there, and they're asleep. Yeah, it's scary.
I used to sleepwalk when I was a teenager.
Did you?
And to this day, I remember it's a very odd feeling. I was very present when your words about what I was doing at the time.
Really?
And my parents could redirect me. It was just
But you knew you were,
yeah.
wow. That, so you felt like you're in a daze, like you're just compelled to do it? Ooh, that's even scarier. Really? Isn't that something? Yeah, I had a cousin who did it, and he'd be at the neighbors, and my aunt would get a call. How frightening. Oh, my gosh. I can't imagine. Oh, my gosh. Can you imagine? And then her saying she was aware of it. It's like, but she couldn't stop. That's scary. But, yeah, so that can happen. So these are all types of sleep disorders that can interfere with our sleep. And then medications that interfere with sleep. There are some medications that treat asthma that will cause, and depression, that can keep you up at night. So it might cause you to be more alert, so you might have to take it a different time of day. And then anybody who's ever had to take an asthma medication, it can speed up your system, keep you up. And then some other stimulants people use. And then over-the-counter sleep aids. When you see like anything that says sleep aid, I'm trying to think of some Sominex or whatever that you buy over the counter. Those interfere with your sleep. They might help you get to sleep, but you don't get REM sleep. Bree. Well, actually, I'm talking about over-the-counter, like, yeah. No, melatonin actually is something naturally occurring in your body. So that really isn't too adversive. Unless you're a teenager, you shouldn't take it. But other than that one's... Right. Those are the ones that say, there's another good one, Tylenol PM, NyQuil, anything like that. Yeah, sure. No. Well, I'll tell you, the over-the-counter sleep ones, like the Tylenol PM, Advil PM, Sominex, have the same ingredients as Benadryl. Or if you take Benadryl, it can make you tired. But the thing is, it won't let you get REM sleep. So people take it, and they're like, oh, I can get to sleep, but they're groggy the next day. It's because you don't get the stage 4 sleep you need to be rested. They're okay a night here and there, if you have allergies here and there. But if you start taking them regularly, you're not getting sleep. So that's why if you are having problems, you do need to talk to somebody. However, there's a thing with, oh, go ahead. Alcohol is a depressant, unless it's tequila, then it's a stimulant. But alcohol can interfere with your sleep. Yeah, alcohol can definitely interfere with your REM sleep. So, did you guys know that?
What did you say?
I shouldn't have told you guys that. It's probably wrong as a nurse to say that. Alcohol is a depressant, but tequila has stimulant in it. Or not in it, but stimulant properties from how they make it, yeah. I know.
Oh, jeez.
I'm not recommending tequila. Let's put a disclaimer right now. It's just a fun fact. So sleep medications or hypnotics, Bree brought that up before. Sleep medications, Ambien, there's so many, Lunesta, those type of meds are for short-term use only, a week or two. What happens is they bind to your GABA receptors in your brain, and they can end up doing some opposite things down the road. So it's for occasional sleeplessness. And there's doctors who will prescribe them to people, and people take them all the time. And then your body becomes used to them, and you can't sleep without them. And it's just not a good thing overall. You're not solving the problem. So these are, again, things you need to talk to your doctor about. But actually, all those medications, they say about 2 weeks at the most. So there's a lot of things you can try before you get to that. But people get desperate. It's a terrible feeling of not being able to sleep. Do you have any?
I was just thinking as I've aged, my pain has increased, which has been very frustrating for me. And that is one of the big things that hinders my sleep at night. I lay in bed throbbing, so then I go back to all of those other things we spoke about earlier, the mindfulness and the meditating, things like that. Mm-hmm. So it's just been a frustrating thing as I've gotten older.
It has, and in Martha's defense too, when you have neuropathy, when you have actual interference in your spinal cord, sometimes you have to rely on more medications or different medications that somebody else wouldn't use long term. And it becomes, like with Martha, kind of a game or a mixture of seeing what works for her. But again, you know, as she added, she still does the meditation or exercises, everything else. It's a combination. There's not one quick fix. Yes? I'm glad you brought that up. Thank you. People still need 6 to 8 hours of sleep, depending on your body. But it's harder because you lose melatonin as you age to get that amount of sleep. So people just end up sleeping less and less, and they find they can get by with it because they're maybe not having a job or they're retired. So they end up getting into that cycle. But ideally, you'd still want, and some people, I'm going to tell the story, and I'm sure she'll forgive me. My mother-in-law is like the champion sleeper. She's 85, and she looks great, but she sleeps like 16 hours out of 24 hours. I swear. No, I'm serious. She gets up at 8. She goes back to bed at 9:30. She gets up, eats lunch. She goes back to bed for a nap. But that's how she functions. But then she'll go, I didn't sleep a wink all night. Well, because you slept all day. But she does sleep because I hear her sleeping. But to her, she worries she's not going to sleep. So I'd say don't sleep in the day, you know. And there was another article. It was interesting. It said cat naps, like 15 minutes can be worse than like an hour, 15 minutes, no more, or an hour. A half hour will make you feel groggy or weird. Yeah. Yes, because of REM cycle. Yes. Yes. It is. Yes. It's okay. Yes, and thank you for that, because I get up at 3 o'clock every night. Sometimes I can get back to bed, sometimes I can't, but I gave up trying. Because I find when I give up, I'm more apt to be able to fall asleep. I'll read, I'll do something, and it's okay. Quit worrying about it. If you really needed it, you'd be asleep, and kind of just settle into that. And I think that's good, yeah.
And piggybacking off of the mindfulness there, like sometimes if I wake up in the middle of the night, maybe there's a reason, and I can do like a check-in, like you were talking about checking in earlier, and be like, oh, I'm really, really, really thirsty.
Yes. Yes.
And get like a
yeah.
drink of water, but not so big that you wake up and you
yeah. But that's a good point.
So,
Yeah, and that's what I always keep bottles of water in my nightstand because that happens to me. And I live in an old farmhouse. And instead of me going, oh, I got to go downstairs, I keep water.
you don't even need to get up then.
No, you don't. So you can do things like that. And then I also, on my iPad, have those meditation apps. So if I really feel I need to check in or calm my mind, or I put notes on my iPad of things that are on my mind and say, okay, I'll worry about it tomorrow because I wrote it down. So there's all kinds of things you can do. So here's daytime suggestions. Setting an alarm. And I haven't set an alarm in years, but I do wake up the same time every day, 3 o'clock now. It's waking up at the same time every day, even on your days off. It is important to try to keep the same schedule, and then include meaningful activities in your daily schedule besides sleep. Get off the couch and limit TV watching, and then exercise every day. Get outdoors and try to get sunlight, which has to do, again, with your circadian rhythms and melatonin and everything. And then limit napping to no more than 20 minutes during the day. And I've tried to talk to my mother-in-law about that. It doesn't work. But really, it's counterproductive if you have sleep issues because you're not going to sleep at night. Then nighttime suggestions. Go to bed at the same time every night. Follow a bedtime routine. So you do the same thing every night so your body knows what to expect, what's coming next. Avoid caffeine, nicotine, alcohol, which you brought up, right? And sugar for 5 hours before bedtime. Well, ideally, it's hard to do. I don't drink caffeine after noon because then I can't sleep. And yesterday I did. I drank coffee in the afternoon and I couldn't sleep. But for some people, that's all it takes, a little bit of caffeine in your bloodstream. And then eating prior to bed, because if your body's busy digesting, you might have a harder time relaxing. And then don't exercise within 2 hours of going to sleep, or those endorphins are going to be pumping. And then this should be a separate line, do not eat or watch TV while in bed. And that's more to separate it in your mind. I do this in this room, I do this in this room. So it's a habit. And then keep stress out of the bedroom. And that's, again, where you take notes or do whatever you have to do, right? Leave it outside. And then create a restful atmosphere. How many people have created a sanctuary in their bedroom? All right. This is something I really recommend doing. Decorate it in colors that are soothing to you. Have things in there you enjoy that calm you, what calms you. So that's a good thing to do, and not really a big investment. And then we talked about this, if you go to bed and you don't fall asleep in 20 minutes, get out of bed. Go do something else. You're not tired. And that was a thing I learned, too, in my 50s, to just give it up. It was something Cindy said to me once. We were talking, and I was like, yeah, I'll just get up and read. And I don't even know what we were talking about, but I remember us talking about it, and then me thinking, yeah, it's okay to do that. You could do that, unless you're lactose intolerant. Then I wouldn't. But, yeah, that's true.
The things that I do each night, I do go to bed at the same time. I drink decaffeinated tea, which really helps kind of calm me and settle me down. And for me, because I can't get out of bed when I've woken up in the middle of the night, I always go back to staying in the moment, thinking about why is it that I'm awake, and then letting that, if it's stress-related or something I didn't do or all those kinds of things, kind of getting that out of my head and concentrating back on just calming myself to go back to sleep, that is what helps me. May not help other folks.
Well, and for some people it is. It's like it's work,
Yeah.
It's work.
To work through it.
Mm-hmm. So here's some other treatments for sleep. Medications, again, for short-term use. You can speak to your physician. A lot of times they'll prescribe them if somebody's going through a traumatic event. Natural remedies. And then, again, that's melatonin. Different herbal teas. Chamomile works for me. Has anybody else tried that? Okay. Does it work for you? A lot, but you can steep a couple tea bags in our valerian. I mean, it works for some people. Yeah, I mean, I find it soothing. Maybe it's a ritual of it, the heat of it, whatever, but it's very calming.
Spearmint tea does a beautiful job.
Does it? Spearmint tea? Okay, there's another one. But whatever works. So, and then there are some over-the-counter things, you know, with melatonin and different things in it. But again, don't give it to teenagers because it has to do with hormones and growth. And I have to tell you, as a mom, I gave my son melatonin. He was having trouble sleeping when he was 12, and he was acting like a drunken sailor. It was awful. I go, what did I do to him? He was slurring his words. He was falling over. And then I read. That was back before, you know, people really looked up things on the internet, and I read that you can't give it to teenagers. So I only did it one night, but he did. He was like, whoa, you know, and I was like, it was just melatonin. It was just an herb, but it really messed with him. So don't do that, or a child at all. Okay, improving your memory. So, memory as we age. The attention or the ability to concentrate becomes affected. It's harder for us to concentrate. You're more easily distracted, and multitasking becomes more difficult. And I always think about that because I'm a really good multitasker. I multitask, and I always have to do 2 or 3 things at once or I feel like I'm wasting time. It drives my husband absolutely crazy because I'll have this out, and he's like, what are you doing? I go, everything. I'm doing everything. I'm answering emails, and I'm cooking, and I'm cleaning, and whatever. And I think why it becomes harder as we age, and I think more when we retire, some people are really active, but some people aren't, is you lose that momentum of having to do so much all the time. You kind of train your brain to juggle all these things, and then you don't have to anymore. So you kind of lose some of that. And yeah, our nerves kind of slow, you know, the synapses and how we process things. But I think some of it's just like training. We just don't have to multitask anymore, so we kind of lose that ability. That's what I think. Is it true? I don't know. Maybe there's other theories. But I always think that's why it becomes a little more difficult, because you don't have to worry about it. You know, because so many people who retire will ask me, well, what day is it? You know, I hear that all the time from people. It's like, well, what day is it even? I don't even know. So you just don't have to worry about as much. And then thinking can become slower because of those synapses. So completing simple tasks can require more concentration. So there are some memory issues that can arise and causes. There's physical changes that happen as we age. Chemical changes happen, especially with multiple sclerosis and with brain injury that can get worse over time. And then breathing issues and sleep apnea, pain, depression and anxiety can cause memory issues. Alcohol, caffeine, and cigarettes can. Medications can. And then dementia can. So if you are having memory issues, you need to talk to your healthcare provider, period, because they need to find out why. My mom has dementia, and my sister, who's 60, started having memory issues, and it was very frightening to her. Here was a med she started taking. And the minute she got off the medication, she was fine. But how scary is that? So always find out if you are having memory issues. So some considerations as we age. Well, first know if you have a disability such as multiple sclerosis, it can lead to cognitive problems. And that's something you want to speak with your physician, of course, if you have a dementia too. And then fatigue, depression, and pain can cause concentration issues big time because you're so distracted. You can't think clearly, especially if you have head and neck pain. It's really a hard thing to do. So cognitive problems can make medical symptoms worse, creating a negative cycle. And Martha could probably speak better than I could to that, about that loop of trying to get around the pain. And
Yes, it's exactly that loop. You start at the beginning of how much pain that I'm in, and also as far as the memory issues. As the pain kind of hits me, and I'm trying to remember something, and I'm finding as I'm getting older I used to be really good at remembering phone numbers. You tell me your phone number and I wouldn't have to write it down. Now, not so much. I'm also finding that it helps me to write notes or to I always have my phone near me so that I can then write on the notes that something that I need to remember in the future. And that helps me with anything that I am doing in improving my memory. So I guess I'm all over the place here. That's another thing that has happened. As I've gotten older, I seem to be one of those people that tends to ramble. All of those issues that happen as you age.
So it does get hard. Again, it's work. You have to, but as long as you're aware of it and you're working with your physician on it and you're trying different things, you're heading in the right direction, you're doing what you can. Yeah, Bree? Yeah.
All day.
Yeah.
Alarms. Do this. It's lunchtime. Go do that. Cell phones, smartphones are just really, really good. It's better than a paper calendar. Because they're active. Of course, writing everything down though, even just in a conversation, if someone's talking a lot like me or something, you just write down what you got to say, and then then you can say it later. So there's lots of things that you can do to get around, a memory that's not cooperative.
And I agree with that, especially with the apps now. It's great. That's one reason we knew my mom had dementia. She got a GPS system to go to places she normally knew. She found a way around it. But you're right. It's a great way to support your memory and to keep everything right there. I use mine for everything. I do. It's great.
One of the things I was thinking about, I have a severe attention deficit disorder along with a seizure disorder. So my mind is basically, between the both of them, my mind is basically bouncing all over the place. I can't focus from one minute to the next. I've known Martha more than a couple of weeks now, and we'll talk about that later. And it's kind of hard. Okay, I want to go to this meeting now, but wait a minute, I got to go here. No, wait a minute. Should I go to this meeting, or should I go here, or here, or here? Sometimes even the technical things, forget it won't work.
Yeah, and do you find writing down help, or does that not work for you either?
Sometimes I'll misplace my notes.
There you go. Okay. So it's maybe a little trickier for him. He's saying, well, that stuff really doesn't fit for what he needs. So there might be it might be a little trickier then, right, to try to get around that. But you got to, go ahead.
I have a funny little story. I work
Sure.
at Comfort Keepers.
Okay.
And one time they had a seminar for forgetfulness. So I signed up for it, and I even wrote it down, and I forgot to go to it.
Oh, that's funny. That's a good one. I like that. Well, Martha and I, can I share, when we were recording this, and we were talking about mindfulness and forgetfulness, and both of us kept saying the same thing over and over. With the 8 keys, we're going to talk about employment and forgetfulness and mindfulness and forgetfulness. And we just kept saying forgetfulness. We're like, forget it. Just forget about it, because we will. So anyway, if you know you do have issues with memory, how are you going to adapt it? And again, if it's something new, you got to get it checked out. So prioritize what you need to get done. Schedule activities during the time of the day you think more clearly. Some people are morning people. I'm not one of them. I think better in the evening. Avoid triggers in your environment that make thinking more difficult. Noise, maybe. Or like you said, you need your white noise. You need that noise. And then avoid visual or sound distractions. And then socialize in crowded areas or loud environments where you lose some of those thoughts. So those are just some ideas besides what we talked about. Set up a daily routine. That helps too. You get kind of used to doing things and you're less apt to forget. It makes it less stressful. Pace yourself. Break complex activities, kind of chunk it out to get it done. And do one thing at a time if possible. If you're having memory issues, that multitasking is not going to work. And it can make thinking more difficult. So writing things down or using the iPad, iPhone, or recording it. Using memory aids such as Post-it notes, planners, or calendars. Timers, which we brought up, are great on your watch or iPhone just to remind you what you're supposed to be doing. And then keep the same routine, same order. And then talking to the health care provider if you need more ideas. Next section is employment. Something people should know, the fastest growing sector of the population looking for jobs are people over the age of 65 right now in the U.S. And a lot of those have disabilities and chronic health conditions. And adults with disabilities can and do have active work lives, but they experience higher rates of unemployment than those that do not have a disability. That's just a fact. So it becomes harder for all of us to get jobs, but those of us with chronic health or disability, it's just a little harder. So, getting a job. You can secure a new job on your own or through personal networks, or you may need a little extra help to find a job. A rehab counselor can help you decide whether a potential job would be a good match for you. And just know discriminating within hiring is illegal, even if it's not intentional.
So, about that third bullet point for resources, because, you know, the problem is if you're being discriminated against during interviews, well, A, you might not know it because they just,
right.
They might just say some other reason, but B, you need to get hired, so you're going out and doing more interviewing, and you're going and writing down more stuff and going to more interviews. So it's and then if you keep doing that and you eventually get a job, well then you have a job, and it's like when would you ever have time to sue somebody?
You know,
like resources.
You know, I agree though, but I just had a friend who was discriminated against. And she called the equal opportunity officer doing everything. She just did one form. So I did recommend her do it. Yeah, I was discriminated once on a job because I was pregnant, and they didn't promote me, and they actually told somebody that. And you're right, it is work to fill it out. But I think, you know, if you are aware of it, you do want to report it because otherwise it just perpetuates that reoccurring. So in Madison, you know, there are resources you can call and report it. But you shouldn't feel you have to do all the work. And they actually are the equal opportunity agency for this person's doing everything for her. So, yeah. Yeah, but if you're right, though. You have to be aware you are, you know. But sometimes it's pretty evident.
And it's not just you by yourself having to, like, call people.
Correct. There's some resources you can call for help. So do you have something to add with employment?
Well, with employment,
My allergies are bothering me.
presently now is one of the statistics that I am unemployed as an older adult, which I found unfortunate. But the plus side is that I'm still volunteering with 3 boards that I'm on, or 2 boards, which are the Transit Plus Advisory Council in Milwaukee and the IRIS Advisory Committee. And then as well, I am the advisor for People First Milwaukee, which has been very helpful, and we're pretty busy at the group in Milwaukee, and that also keeps me busy and connected. I think it's important to stay connected with the nonprofits that you may know or people in the community. That helps me. Yes. I don't think there's anything.
Oh, no. Yeah, and this is exactly, it's important. And Martha's very active and very connected. And like she said, up until recently was employed. And she will be again. I know she will be. She's a great asset. But volunteering's another avenue if you're looking for a job. It also could lead to a job, right? But if paid employment isn't possible, consider strongly getting involved in volunteer work. Every community needs volunteers. We all have gifts and strengths. Yes?
I was going to say, my primary person that I work with, who's in a nursing home right now, rehabbing, she does volunteer work. She's 55, turned 55 at the beginning of the week, and was basically told if she got a job that they'd take, like she could only work like 2 hours or whatever by DVR, and just this whole rigmarole, and they would take a lot of her social security away, and
Right.
That whole old way of thinking, I guess. So she just started getting into volunteer work, and she works, does intake for a food pantry in our area.
Cool.
She loves it. She misses it because she can't do it.
Right.
That she's doing, and she keeps in contact with the director, and she came and visited the nursing home because they did a trick or treat thing, and our director has a 1-year-old, and so she brought him to the nursing home to do the trick or treat thing.
Oh, that's
Don
nice.
loved it because she misses
Sure.
that connection to the volunteer.
It's important, and that's the word, connection. And Martha said, the importance, like she's on a lot of the boards that provide different services, and it's a good way to be connected and know what's happening, and also help push some things through, right, because she uses those services, so it's great. So it can lead to enjoyment, sense of accomplishment, right, give you skills and confidence that can lead to employment. Yes?
One thing about volunteering is you find something that you really enjoy doing. For instance, science is my life. And I do some volunteer work down at the Milwaukee Public Museum.
Oh, cool.
How many of you folks can say with a straight face that you held a 65-million-year-old fossil in your hands?
I have
Or
not.
How many of you ever held a 4.6-billion-year-old meteorite in
Yeah.
your hands? I can say that.
That's cool. So and did everybody hear that? He loves science. It's something he has a passion for. And that's key. If you're going to volunteer, try to find something you have a passion for.
Well, volunteer actually means for the love of it.
Yeah, there you go. Thank you. So, and it will not put your benefits at risk, of course, right? It's something we can all do if you have a little time or a lot of time. Okay, we're going to have a table activity, but I don't think we're going to have time, which is fine because the table activity was to promote discussion. And we've been discussing, so I think that's okay. So getting the most out of healthcare visits. It's so hard when you go to doctors because you only have so much time, right, to get out your story, right? Just a little time. And there's a lot of things you got to get, and I don't know about you guys, but you always feel you get in the rush, right? Just get in, quick get out what you have to say, and you're out the door. So how do you get the most out of your visits? Well, it's called PACT, Prepare, Ask, Create, Takeaway. It's just something to think about to get organized when you go on visits. And you guys have all that in your packet. So first prepare, and now it seems like every time I go they either want a picture or they want, handprints or thumbprints or this ID. Where my mom goes, she has to show her ID every time she goes because of insurance fraud. So make sure you have everything and have it in habit. Have it in one place. Make it a habit to have all the cards you need. And just when you think they don't need your card, they'll need another copy. So, and any other healthcare providers, they'll always want to know your pharmacy. And this is especially important if you're seeing a new doctor. So, list of medications and all supplements. Just because they're not prescribed doesn't mean you have to not tell people. It's really important you disclose everything you're taking, the dosage, and then any alternative medications as well. Any adaptive equipment that you might need, and then of course eyeglasses and hearing aids, and then a family or friend for another set of ears, especially if it's important discussion. Because if you're trying to listen to the doctor and they're asking you questions, you can miss some key things. So I think that's always important to try to do that. Another set of ears. So, and then kind of jot down, why are you going? What are your symptoms? If it's just a checkup, that's not that big of a deal, but a lot of times we're going in for a reason. So write down, and the doctor's always going to say when, how often, are they constant, are they intermittent? And sometimes you're just trying to think, and then later you're like, oh no, I said that wrong. So it's kind of important to write those things down. And then how, they're going to ask, how does this affect your daily life? How does it interfere with your daily activities? So that's important to know. And then find out how much time when you make your appointment, because the scheduler is going to put you down for 15 minutes or a half-hour appointment. So find out how much time and plan ahead. Sometimes they're squeezing you in, and they're going to squeeze you right out. So if you're going in, make sure you have it planned out so you don't feel like you wasted your time or that you have to go back. And then be on time and plan getting there early. Write down questions and put them in the order of importance. And then if you don't understand something, please tell them to slow down and not talk too fast. And that is so frustrating to me because I think I go with my mother-in-law and my mother to doctor's appointments. And their doctors just da-da-da-da-da-da-da-da-da. And I'm like, stop. Because I'm trying to write things down. I'm like, really? And here's my mother-in-law. Uh-huh. Uh-huh. Mm-hmm. And I go, did you hear what he said? Not a word. Uh-huh. Mm-hmm. And it's like, really? What did he say? And all I can say, stop. She's not hearing what you're saying. Stop. Yes.
And to add on to that, I was a clinic nurse for about a year or so. Doctors also get very frustrated because none of them went to medical school to treat people like that. But it's the behind the scenes. And doctors will say, I would love to spend an hour with you. But the bean counters tell me 10 minutes or 15 minutes, whatever.
Right. So, yeah. Good. Yeah, and thank you for that, because with my mom, I always take everything to Dr. Kogani. She goes, thank you, Sue. You're making my job easier. But if you just sit there and the doctor thinks you're understanding, they're just going to buzz along. So having that, wait, let's talk through this. You're right. They'll appreciate it, too. So that's good.
I've actually brought a typed-up list when I would attend appointments with my parents, and actually the nurse usually comes
Uh-huh.
that pre-visit part of it, and that they'll always ask what questions
Yes.
for the doctor. And when they see that you're reading things off of the list,
They like it.
the list, and then the doctor comes in prepared. I even had one individual who actually started to bullet point
Wow.
some of the answers, which was helpful.
And you're right, and then they'll address those concerns. And what's hard for doctors when people are jumping all over, oh, and I have this, and I have this. It's like, what are you there for and what's most important? So, yeah, those are all good. So think about that, preparing. And then ask, if you're going to have tests, find out what is being done, what are the steps involved, and then do I need to prepare? How do I get ready for this? Are there any dangers or side effects to tests? How will I get my results? Because that is one that's always hard to find out. And how long will it take? What will we know after the test? And will I get a copy? And those are things that I still have to remind myself always to ask, because that is very frustrating when you're going through testing to find out. Some doctors will say, well, it may be good if we do this test, but you decide. I hate that, but they do that. And I'll be like, really? You want me to decide if I'm going to have this test? Well, what if I don't get this test, or what if I do? And then finally, and this always works, what would you do if it was your mother or your wife or your partner? What would you say? Or what if it was you? What would you do? Sometimes that'll push them into answering it. And they'll go, well, I'd get the test. I've had that happen twice in a year. It's like, well, then just say, I'm ordering this test. I think you need it. But I think because some people don't have good health insurance and the costs, they're giving you the option. But then is that really why you're going to them? It's not like, well, we should replace your battery, but maybe you'll get a few more months out of it, It's your health. So always ask that. Yeah. Right.
I know something's wrong.
Right.
I know something's wrong. Why keep guessing?
Just find out.
And so, you know, after the rigmarole, it was really, really, it was life-saving. So it's like, I'm not saying it's easy. No.
It's not easy. But you're right. You have to advocate for yourself, don't you? And you think about people who don't have that ability always or are afraid to speak up. But it's vital because especially when you know something's wrong and you need an answer. Or if you have a serious test done and no one calls you. And it's very frustrating and painful. And that happened to somebody I know not too long ago. And the doctor said, we think this is wrong. We'll do a test to find out for sure. And then they never got a call back. And no one would call them back for a very long time. It's distressful.
What about doctors that aren't necessarily educated on people with like certain disabilities? How do you address that?
Yeah, and that's an excellent question. Yeah, well, and you know what, that's true, and they'll admit it. When I worked in Dane County, and I worked with some people with very complex medical conditions, the doctors would call me when certain things would happen, or I'd take somebody in because their G-tube site had closed, or they need something. I'd have to tell them what to do. And I finally started giving the education to the doctors, because now, and again, it's an advocacy thing. If it's something rare and usual, you don't think you have to, but you do, because there's not like classes doctors take. Right. So sometimes it's like, will you read this? And then it prompts them to go online, because doctors do that now. They just go online when you leave the room. That's how they find out some things that are unique or tricky, or they'll do it in front of you anymore. But if it's something that you need to educate them on, there's nothing wrong with that. And if they really don't seem interested, I would agree, find another doctor. And in Madison and Milwaukee, there's a lot of providers to choose from. It's different, but you get out into outlying areas and it may be tougher. But there's nothing wrong with saying, I want you to read this. And I think any good doctor would go, okay, let me read this and find out more. Oh, this is interesting. I didn't know that. But I find I've done that over and over in my life. Yeah, and it's a constant battle. But they become a physician usually because they are inquisitive, but they don't have to know about this specific thing,
And especially with getting older.
Yes.
Donna is 55, so Donna's going through menopause and all those things, and she just had a bone break, and I'm afraid that they're not dealing with it right.
Okay.
Because she's also got CP.
So it's a little unique. Yeah. So it may be.
And it's a low break. It's just above the foot, like the ankle.
Yeah.
So I'm just hoping that.
Yeah. Where do you live? What city? Okay. Yeah, and it can be trickier, but too, if you guys had the experience of going to a nurse practitioner or PA or physician, sometimes you get more time with them, and you'll get more time. But it is hard. But again, if you're not getting what you think is right, you need to go a little farther. So medications, if they want to prescribe something, always ask. Right? That just seems, especially internal medicine doctors, they're really quick just to prescribe. And then what are the benefits? What are the side effects? What if I don't take it? What else can I do? I don't want to take another medication. Or how long will I need to take it? Will the medication have an interaction with other things I'm taking? And that includes over-the-counter medications. So then creating a plan, that's when you make decisions with your healthcare provider. And let him know everything has to come through me, right? Just because I have somebody else here. And then understand the decisions that have to be made. Make sure you know all the options, the pros and cons. And then remember that waiting on a decision might be an option. Let's just wait and see. That might be an option. And tell the healthcare provider if you have concerns about any of the decisions that are made. And make sure you understand the plan. And then take away any information that might be helpful. You guys see it in waiting rooms, but you can also ask the doctor, do you have any more information on this or that, whatever you're there for? And a lot of times, they'll give you information. Some clinics are good about post-visit print-offs that'll tell you what's going to happen next or what they're working on so you can do your own research. So you want to take those written plans. Or if you have like a My Chart, you can go in and look. And then contact information. If I have more questions, who do I call? Some physicians give you email addresses. And then any brochures, articles, audios, anything that will help you, and then recommendations and trustworthy websites. Just don't go out there looking at Wikipedia. There's like Helpline, Med Helpline. There's some reputable sites you can look at. Mayo Clinic is an excellent one, thank you. And Cleveland Clinic is an excellent one. UW has lots. So those larger teaching hospitals have set protocols. But you have to be careful because sometimes they'll say, this is bad for you. And then you'll find out there was one study that a drug company did on 3 people. So just be careful when you're looking up information. The next thing is fall prevention. Accidental falls are the leading cause of injury-related death in older people. Huge issue. So older adults with physical disabilities are at greater risk of falling than older adults without a physical disability. And they usually occur while you're doing everyday activities. So walking, getting up and down, tripping over a throw rug, showering. And the fear of falling is very powerful. You may not even realize how this is limiting your daily activities and you're afraid to do things because of that fear. So, risk for falls. If you live alone, you have a history of falling, muscle weakness, poor balance or coordinations, gait issues, problems with how you walk, poor vision, wearing poor or unstable footwear, some medications, or the combination of multiple medications. Was anybody in Peter Leidy's session yesterday? He was talking about that gentleman who fell over a shoelace, you know? So it's like, really? And then he had Velcro shoes after that, but that really, changed his life. So things like that. Medications or a combination of medications can make you unsteady. Thinking problems, not being able to concentrate on what you're doing while you're walking, not using assistive devices if you're supposed to, poor diet, not drinking enough water, and alcohol use all increase your fall risks. I'm going to let you talk.
Wheelchairs. Wheelchair spills would be mine.
Yes.
Trips or falls in wheelchairs account for a lot of fall-related injuries for wheelchair users. For me, I have to be very careful as I am walking down the street to make sure that I use the curb cuts. There are times when I forget that I am disabled, and I'm tooling down the street and get to the corner and have to make sure that I use those curb cuts. Also, I am careful in my home to make sure that, again, there aren't things like an obstacle course that I have to move around my house, and therefore would hit something that I could possibly get unstable in my chair. I do have a seatbelt that I wear all the time, which also makes sure that I stay in my chair. And the other issue with me is when I get on van lifts, that I do get concerned about falling. Going backwards is scary for me. So I just have to make sure that in my environment that I'm always aware of what's around me.
Yeah, and that's a good point, because I've seen people where they've backed up onto those ramps and have got it on their wonky or one tire off. Yeah, so that's something that can happen, and whether you're in a chair or not. So it's something to remember to be present all the time to try to decrease falls. So also, if handrails or stairs or grab bars are missing and not secured properly, poor stair design, dim lighting, obstacles or tripping hazards, or slippery or uneven surfaces. So that's something you should do in your home or have somebody do for you to make sure it's as safe as possible to decrease your risk of falls. So exercise, again, we talked before about mobility and gait and strength to decrease falls. And working with a physical therapist if you fall, they can maybe see what you're doing wrong. Maybe you're not picking up your feet enough or using the wrong equipment. or the devices aren't fitting you right. And then you can actually enroll in a fall prevention program. And Silver Slippers helps, right? Is that where a lot of people go there? Yeah.
Well, Medicare pays.
It does. Medicare pays?
2 times a week.
2 times a week. Okay. Good.
Gym as well.
Pardon?
You can use the rest of the gym as well, or you can go to just the spots where they have the Silver Sneakers program, like some gyms and different things like that would just have that.
Okay. Yeah, so check it out, you guys, the Silver Slipper programs. That's a good tip. And then energy zaps. Let's talk about the last section. So, we all know, or if you do have chronic health problems or disabilities, when your good time of day is, a lot of times we have more energy in the morning when we get up. But there's something called, energy reserve. It's how much you have. You just don't have an endless amount of energy. And someone told me about thinking of it this way. In the morning, it's like a full glass of water, right? And every time you do something, you're taking water out. And midday, kind of depleted, right? And towards the end of the day, you're done. You've had it. So if you're going to want to go out to dinner or you have an activity in the evening, it's something to think about. How do you keep those reserves? And how do you plan ahead so you're not depleted? And I hear that about people all the time. Have to kind of plan ahead. And especially if you have cares in the morning, or I've also known people with CP who who can transfer in the morning but need a Hoyer at night because they've used up all their energy and they just can't do it anymore and they're depleted. So it's just something to think about, how to conserve your energy during the day.
I'm just thinking about my lady friend, Martha knows her also, and people assume that she has CP, but she has what is called arthritis, which is a whole different ball of wax than CP, and I can't stop thinking about her, but if she were to fall, she is she's pretty independent while she's in her chair, but if she were out of her chair, she's at everybody's mercy. I can't stop thinking about that.
That worries you? Well, maybe some of this idea about fall risk you can share with her, right? That would be good. That would be good. But anyway, just kind of think about that visual on how to reserve that. There's different types of fatigue. There's some chronic conditions that make you fatigued just in itself. Multiple sclerosis, muscular dystrophy, post-polio syndrome, and spinal cord injuries. That can cause you to be fatigued just having that. So that's what's called primary fatigue. Nothing else is causing it but one of these. Then there's secondary fatigue. So if you have an infection or an injury, a side effect from medication, you're not eating right, you're not exercising, you're stressed or depressed, you're having sleep problems, there's environmental causes, or you have what's called superhero syndrome. That's when you overschedule and you're doing too much. I always call it hitting the wall. You just get so tired, when you sit down, you fall asleep. Or disorganization of physical surroundings, such as clutter, can actually take your energy away because it's stress thinking about it. So anyway, primary fatigue, there's not a lot you can do about it, but the secondary you can. So think about those things. What can you do to keep those reserves up? And if it's a sudden thing where all of a sudden you're just really tired, think about that. It could be an infection. It could be something else going on. Ta-da! You guys like that? Do it again. Okay, so helping keep those energy levels up. Exercising, naps, but no more than 10, 15 minutes, right? 20 in a whole day. Pacing yourself. Keeping your nutrition. Sugar is really bad because, right, you're going to get that high from the sugar and then you're going to crash. So that isn't a good idea. So be mindful of what you eat. Stress reduction. Trying to work on your sleep. and using assistive devices when you're supposed to, rather than just try to do it on your own. So, do you have anything you want to add to that energy part?
The energy part, I just want to mention when my energy is best, and that is I am a morning person. So I like to concentrate on the things, my thinking activities in the morning, which then it helps me in a couple ways. It helps me organize my day, figure out what I'm going to do during the day, and if there are writing activities that I would like to accomplish, getting prepared for something at work or volunteering or some of the boards that I'm on. I always do those things in the morning and process how I want to handle the day. That helps my energy. And as I've gotten older, because of my spinal cord injury, it is true I have found that I don't have quite as much energy, which I then think of not to get down on myself, but the ways that I can try to take care of myself in order to make my life better.
Right, those secondary things.
Yes.
Outside the spinal cord injury. So yeah, there's stuff we can all do. So I hope you guys got some ideas and tips. I appreciate all the discussion throughout. I think that was great. We thank you for your time and attention. Remember to take your handouts. There's extra ones at the table. If you want to take them, that's fine. And, oh, go ahead. Yep. So thank you very much.